I know that families of those whose children have got allergies will relate, because as I describe it, it's like Russian roulette. Your child, when they're little, as a mum, you can control what they're eating, and then they go out into the big wide world by themselves. And Tanya, your daughter Natasha, ate a baguette from Pret at the airport. She was about to go away, her dad and a friend. It had sesame in. She had no idea. She went into anaphylactic shock, and the EpiPens couldn't save her. You want an Allergy Tsar to champion these youngsters, adults who are living with this Russian roulette every day. How do you think an Allergy Tsar might help, do you think?
Currently, well, first of all, it's really important to understand that allergies are increasing, food allergies particularly. So when Natasha was in school, she was probably the only child in primary school with a food allergy. Now you're seeing 1 to 2 minimum food allergic children in every class. And it's just growing and growing. Every 20 years, A&E hospitalizations increase threefold. So scientists are saying if action isn't taken, by 2060, 70% of the public in the UK could very possibly have diagnosed food allergies.
Wow. A huge majority of us could all be experiencing
that's the background
risk.
Yes. And the situation is that there just aren't enough allergy clinics. There aren't enough, GPs don't have understanding of allergies. So quite often diagnoses are very delayed, and anaphylaxis will occur numerous times before someone is even given an appointment to be allergy tested. We just have a situation where we've got a tsunami coming on the horizon of allergy, and the country and the NHS and primary and secondary care is just not able to support it.
I mean, at the moment, the allergy care in the UK is completely fragmented. We have GPs that are not trained in allergies. They don't understand them. They don't understand the guidance in terms of prescribing pens and looking at the dosage that are needed. And the dosage is needed to increase due to age. So, you know, Shante needed an adult's dose, and she had a child's dose at the time that she passed away. Now, an Allergy Tsar, in our view, would act as a public champion, bringing all the services together. And we want there to be mandatory recording when there is a near anaphylaxis episode at hospital. So we've got some evidence to use to do some research and some mandatory training for GPs. We need more allergy care specialists in the UK and somebody to coordinate everything. People deserve, like Shante, they deserve to have one coherent pathway care for allergies, and to be able to call for an ambulance and they all be categorised as a category 1, because it is a life-threatening disease.